to present. And without wasting our time, I'll call on Ms. Einas Mohammed to make a presentation. Ms. Einas Mohammed is the African Coordinator on Security Council Resolution 1540 at the UN Office for Disarmament Affairs. Ms. Einas, come to the stage, please.
Thank you very much, Mr. Doughton. Excellencies, ladies and gentlemen, Your Excellency, Professor Aiken Abayomi, it's a great pleasure for me to be here today, and thank you so much for welcoming us to this excellent conference. We have learned a lot this morning, and we are happy to be contributing our bit as we speak about the non-proliferation international framework and its synergies and complementarities with the biosafety and biosecurity objectives, as well as the One Health approach. So as kindly introduced by Dr. Doughton, my name is Einas Mohammed. I am the United Nations Office for Disarmament Affairs Regional Coordinator on Security Council Resolution 1540. And I am based in Addis Ababa and hopefully co-located with the African Union there. So my objective today was to speak to you about Security Council Resolution 1540, why it is relevant to the topic of this conference, what are the state's obligations pursuant to the resolution, and how can we work together to overcome the challenges that are faced by the region and African states in implementing the resolution fully. I thought I had to speak about the relevance of the resolution, but this is really not required. What I have seen throughout this day, throughout the morning, that there is a keen and great awareness amongst all of those present about the risks involved when it comes to issues of biosecurity. The COVID pandemic has clearly shown us the vulnerabilities that we contend with, where we have perhaps overlooked in the past, and Professor Abayomi, I believe, made a really key point, is that when we blow the whistle, we are alarmists. But then when the fact happens, that's when we reflect and we think we should have listened to those who have raised that alarm. So Resolution 1540 is actually an instrument that is specifically designed to address some of those threats that we face in the biosecurity and biosafety field. Resolution 1540 was adopted by the Security Council resolution in 2004. And by the mere fact that it is adopted under Chapter 7 of the UN Charter, it becomes legally binding on all states. The resolution does not detract from states' obligations under the Biological Weapons Convention. That was just described to us now by Melanie. In fact, they are meant to complement those instruments and many others. The resolution is distinctive in the fact that it addresses the specific threat of the illicit trafficking of all material that can go into the making and the use of weapons of mass destruction. This is different because most of the instruments that are negotiated by and among states govern the activities of states themselves. But Resolution 1540 extends beyond that and looks at the actions of non-state actors, those that we cannot negotiate with, but we can regulate, however. So in terms of the scope of the resolution, it specifically looks at non-state actors and aims to ensure that they do not become engaged in any activity that can lead to them acquiring, producing, developing, transferring, and using weapons of mass destruction. What do we mean by non-state actors? Non-state actors include any individual or entity that is acting outside the law. And so with that definition of a non-state actor, the resolution aims to ensure that such actors do not acquire the material, but also the means of delivery and the means to produce such weapons of mass destruction. As I said, I don't need to dwell on the relevance of Resolution 1540. The threat is present and well documented and has been experienced in the past. The desire of terrorist groups, for example, to acquire weapons of mass destruction is no secret. Al-Qaeda, for example, has in the past expressed its interest in seeking and acquiring weapons of mass destruction. We have seen weapons of mass destruction or material, and maybe we don't need to speak about weapons of mass destruction because everyone is going to think that this is a sophisticated weapon that is in the hands of few. But we're talking about chemical, biological, and nuclear material that can be adapted and weaponized. And that can be fairly simple if means are available. We have also seen individuals deploying biological agents to harm others, causing great panic, but also death and destruction. And we have seen also an increased role of the private sector in biosecurity issues, in bioproduction. While non-state actors play a very important role, they can also be exploited for non-state actors to acquire biological material that can be destructive. The threats that Resolution 1540 aimed to address are not unfamiliar to the region, and we heard about this throughout the day. The Africa region, and West Africa specifically, is still contending with the threat of terrorism. There is an Interpol report that refers to the growing threat of transnational organized crime in the region. It speaks about the growing sophistication of transnational organized crimes and their linkages with international and other global networks of crime. And so the threat is really palpable as we see it in the region. The problem of biosecurity is also not new in the region. We have had experts, including Professor Abayomi, who have published widely on this topic. In the aftermath of the Ebola outbreak, thousands of samples, Ebola samples, were not accounted for. And samples that were present were being kept under unfavorable conditions in facilities that have very poor safety and security measures in place. So this has prepared, I believe, the region to the progress that we have seen and that has been spoken about throughout the day. And we also don't need to look about the large-scale attacks. Even a small-scale attack can have a devastating impact. It can cause panic, economic loss, but it can also deter investment and deter cooperation with international partners. So what does Resolution 1540 really ask states to do? Those obligations are contained to a large extent in the Biological Weapons Convention that Melanie spoke about, and they are also contained in the international health regulations. But there are other added measures that states are expected to implement. So there are 3 operative paragraphs in the resolution. First, states are expected to express political commitment and to reaffirm their political commitment not to assist non-state actors in becoming involved in any of the activities covered by the resolution. Then they have to translate this political commitment into legal frameworks. And we heard throughout this morning the importance of legislation to regulate the work of the different government departments and to regulate the work of the private sector as well, but also to ensure that these national institutions, because they have the laws in place, can access the government resources they need for implementation. And finally, operative paragraph of the resolution speaks about enforcing domestic controls. So it's not only about having legislation in place, but having the resources and the capacities to ensure that they are being adhered to. So in terms of bio threats and the biosecurity measures that are contained in the resolution, those include, for example, measures to account for and secure the production and the transport of biological materials. They also include regulation of physical protection in the facilities, ensuring that the facilities are operating with the minimum acceptable standards that are recommended by the international instruments and by the World Health Organization, and ensuring that there are proper licensing procedures in place for labs and for other entities that are involved in biology. Reliability checks of personnel, making sure people who work in these facilities are well vetted and are subject to proper controls, and that they continue to be trained and are able to undertake their task with the maximum biosafety and biosecurity measures in place, and ensuring that there's other legislation in place of biological materials and their related biological agents and materials. So as I said, the resolution is not a burden on states. It complements existing frameworks. This is a slide that shows the complementarity between the Biological Weapons Convention, Resolution 1540, and the international health regulations. These instruments, when implemented together in an integrated and complementary way, they are able to provide what is so-called the web of prevention, so that not only are we focusing on one topic, but we're focusing on the full spectrum of biosafety and biosecurity. We are assuring security, we are abiding by the international framework, but we're also putting in place the biosecurity systems that will allow the state to, over time, develop all sorts and develop its technology and biological technology applications into the future. So where do we stand now in terms of implementation of these instruments in Africa? Unfortunately, not all states have the same commitment and resources that have been exhibited here in the state of Lagos. We are behind in terms of implementation. The top left graph shows the overall implementation of Resolution 1540 across the globe. And as you can see, Africa is a region that is still underperforming. And this applies to all the measures under Resolution 1540, covering biological, nuclear, and chemical. However, all of the reviews that have been undertaken so far on the implementation of Resolution 1540 in Africa indicate that biosecurity remains the weakest area of implementation. So there is still a long way to go. And this data is further substantiated by data generated through the joint external evaluations by the World Health Organizations, and that is amongst the many tools that are used to monitor states' implementation of the international health regulations. It shows that on average, biosecurity is implemented to about 23% only, compared to the other measures in the international health regulations. Furthermore, the Global Health Security Initiative also shows that when it comes to biosecurity, the Africa region remains underperforming. And as you can see, most of Africa is colored in red, means that it is the region least prepared when it comes to biosecurity. So why haven't we been able to make the progress we need to make, despite the political commitment? And there is very strong political commitment that has been expressed by states in international forums, in Geneva, as described by Melanie, in New York, when it comes to Resolution 1540, as well as in Addis Ababa at the level of the African Union. There is a resolution adopted by the African Union Summit in 2013, which called for universal implementation of Resolution 1540 in Africa, and called for the African Union Commission and the United Nations to work together on delivering the capacity and assistance that African states require. But we are still facing a number of challenges. First, most states are dealing with pressing security and development priorities. And I'm sure many of you here in the room, practitioners and experts, have probably struggled to get across to senior decision makers to get legislation passed, to get funding allocated. And this is a problem that we continue to see. But this is also due to the lack of, or the limited understanding that these decision makers have when it comes to the obligations and the objectives of these instruments as well as their benefits. And this is something that we need to, as experts, as practitioners in the field, to be able to convey the message to our leaders and to explain that there are benefits to be reaped. These are not international instruments or international obligations that exist in a vacuum. They do serve a purpose and they can contribute to biosafety and biosecurity at the national level. We also deal with the problem of the absence of the relevant sectors in the international platforms that deal with these topics. Whether those are meetings on Resolution 1540 or the Biological Weapons Convention, we often are dealing with diplomats. And we are dealing with one sector that is concerned with implementation, but not the other. This conference today is exactly what we desire. We have in the room health practitioners, customs officials, the Navy, the security sector is here. This integration is what we are severely lacking when it comes to those international instruments. The people who are supposed to make decisions, adopt the laws and implement those laws are rarely together in one room. And when we try to bring them together, it's usually the first time that they're meeting. So we need to see more of this. And again, we very much congratulate the GET Consortium for bringing such an excellent group of practitioners, decision makers in one room, willing and committed to make progress. And we hope to see that this progress is not only strengthened in Nigeria, but is cascaded and is replicated across the region and in the West Africa region. And I understand that we also have with us the West African Health Organization that we hope to collaborate with as we move forward. There's also the problem of the, as I said, the low political and financial support from national decision makers, which we do hope to overcome through greater awareness and greater collaboration between the different sectors. We also often hear from states that, well, we are committed to the international non-proliferation framework. We understand that there are real risks about biological agents falling into the wrong hands, but we simply don't have the capacity to implement. And if we commit, we will become burdened by these obligations and we will risk failure. And to those type of arguments, we say this does not need to be the case. There is international assistance out there. As we have heard earlier from our colleagues in the Global Partnership, the Signature Initiative is one of those instruments and frameworks that are designed specifically to help states implement their security and non-proliferation obligations, while at the same time addressing their national health sector and public health development needs. So how can we move forward? And again, I really wish to take this opportunity and to call upon all of you to continue to working with us at the United Nations, with our international partners, on bridging the gap and on addressing the challenges that I have just referred to. And this is a call to all of the GET members from the health sector and also from the security sector. We call upon you to engage in regional and global dialogue on biosecurity. Do come to the meetings of the Biological Weapons Convention. Be part of the discussions about how can we move Resolution 1540 forward, how can we better implement it, and how can we better come up with innovative solutions for its implementation. Raising awareness among stakeholders. And here, as I said, there is a great deal of awareness in Lagos, clearly. Let's cascade that to the other states, but also let's take that message to the West Africa region as a whole and to the African Union as well. And we will hear later from Dr. Tokmor Maruta, who will speak about the African Initiative on Biosafety and Biosecurity, which also integrates Resolution 1540 and the Biological Weapons Convention. So we really need your help to explain, as experts and practitioners in the field, the necessity for biosecurity, and provide the technical expertise that states often say that they lack. There is expertise in the region, there is expertise in this room, and we have seen the innovation throughout the morning that was exhibited during consecutive disease outbreaks. So we hope to count on your technical expertise as we move forward. And let's continue to strengthen intersectoral partnerships. We cannot speak about these issues with the security sector alone, nor can we implement it with the health sector alone. We need multi-sectoral approaches. We need the customs and law enforcement officials, the people who will be at the borders, making sure that materials are not seeping through the borders, in or out. We need to make sure that they are well trained to understand what materials are being controlled and how they can enforce such controls in international and regional trade as well. So thank you so very much for this opportunity, and we look forward to working with you and strengthening partnerships. We are here, myself and Dr. Christine Olinot, and we do have some printouts handouts that describe all of the topics that we have discussed during this session. So please do come and speak to us. We will be here up until Friday. Thank you so very much.